Very good. So welcome everyone. Again, welcome to session 4 of the Community and Stakeholder Engagement Learning Collaborative. Today, we're going to be talking about engaging communities in change. Like I was saying, this is such an important topic for recovery community organizations and the work we do, because it feels like we live in an ever-evolving, ever-changing environment. You can go to the next slide. So funding for this learning collaborative was made possible by a grant through SAMHSA, and views expressed here today may not necessarily reflect the views of the Department of Health and Human Services. Next slide, please. Again, we focus at the Peer Recovery Center of Excellence. We focus on 4 core areas. So we help with integrating peers into various settings, building and strengthening the capacity of recovery community organizations, coming alongside and creating opportunities to strengthen the peer recovery workforce, and then providing evidence-based toolkits and resources. And always, if we want addiction destigmatized, we need a language that's unified. And this is just a reminder that we never want to describe somebody as their disease or their diagnosis, and always remember that they're a person first. A little bit of housekeeping. We love seeing your faces. So if you have the ability to be on camera, please do come on. These sessions are for you, so you can make that decision. But the more engaging the session, the more we all get out of it. Today's event is being recorded, and it will live on our website on the landing page for the Learning Collaborative. When you're not talking, if you can keep your line muted, that would be great, so we can avoid background noise. And then feel free to use the chat to offer any reflections, to add questions if you don't feel like unmuting yourself. And from here, I give it over to Mitzi. Welcome, Mitzi. Thank you for being with us today.
Yes, thanks, Chris. I'm really glad to be here today. Very excited to be here with all of you. And I think the first thing I want to do to kick it off is just kind of every month we've been talking about, you probably heard from me if you've looked at those extension learnings. I've been sending out content just to kind of encourage you all, more things that are more tips and tools for community engagement, from TED Talks to other small brief YouTube videos of how to be more involved and more engaged, and ways to support you in your practice. So I just wanted to kick it off by just having the opportunity to hear what's going well with you all, right? What's working, what's going well? Is there a moment that you've been proud of in the last month or so that you've engaged someone, whether in your work or in maybe you're leading community change on your own? If there's any moments or highlights of just bright spots, I'd really love just to highlight those right now. So you want to take yourself off mute and just share kind of a bright spot of what's going on in your work. It's always so encouraging for all of us to hear.
I'll go. I'm Cynthia. I'm in Grand Rapids. What seems to be working for me is I've been able to step back from my job and focus on Mission Restart and my kids and my family. And it's actually, at first I was really scared, and I'm just really starting to get used to it and enjoying the time that I'm actually getting. So I'm just grateful that things are as they are, and realizing it's okay to take your time on things sometimes. So.
Yeah, thank you, Cynthia. Thank you for sharing that. Because in this work, taking care of ourselves is so important, right? That self-care, and hearing you have the time to be able to, like, you're taking the time to do that for you and prioritizing yourself and your family is huge, especially in the work that we do. So yeah, thank you for sharing that. Yeah. Anyone else want to share as well? Okay, so there'll be plenty of opportunity throughout this time to share. If you've got something that you want to say, just kind of jump in there, put it in the chat, or just kind of unmute yourself. I'm completely fine with that. I do want this to be kind of like more of a conversation. And so if you have things that you want to say or contribute, feel free to jump right in there. So today we're going to talk about how do you engage communities in change, right? So we talked about the cycle of change, right? So today we're going to focus on the cycle of change, and we've talked about the cycle of change in the last 2 sessions. So today we're going to recap that real quick, and then we're going to talk about the rest of the change cycle. So it's going to include things like strategic planning, implementation, evaluation. My goal is that today you walk out with additional tools for engagement, and then also that you also walk out with additional networks built throughout this collaborative and context that you can reach out to, or people that you know are that are doing work that you might be interested in, or have solved a problem that your community might be experiencing. So just also that additional networking as well. And again, when we think about tools, I'm really thinking about tools that when you're leading change in your community, that you have the tools to lead that change. Also tools that when you are participating in that larger planning efforts by the behavioral health community as a whole, that you understand the tools that they're using so that you all can be embedded at those tables. It is so important for you all to be at the tables when planning is going on for behavioral health. And so I want to make sure you have the tools to know, if you don't already know, what's going on and how you can be further embedded in that work. And then also tools to engage subgroups within the recovery community in your change efforts. So how do we make sure that you have tools to really engage on 3 different levels of engagement? So to recap the process of change, really we're looking at how do we facilitate change in the community? And we focused in on the strategic prevention framework. Again, just because it says prevention doesn't mean it's specific just to prevention. This is a framework of change that could be used with a number of things: treatment, prevention, or just small changes in your community. If you remember back to the community toolbox, there were a number of different frameworks in there for you to choose from what would fit your community. And we've pulled this one out just kind of as an example. But most of them have this cycle, right? You'll see assessment, capacity, planning, implementation, and evaluation. We talked about assessment in month 2 in April. And then last month, you talked about organizing, right? And so organizing was really around how do you build capacity? How do you mobilize people? How do you increase your resources? And so today I want to touch on planning, implementation, and evaluation. So you can see we have a lot of work to do today, right? I want to cover a lot of topics, but I also want to make sure that we're having a conversation and that any questions that you have are answered as well. So with strategic planning, how many of you are already familiar with strategic planning? How many of you somewhat? I see some are somewhat familiar with it. So strategic planning is that process that organizations go through to help them understand what's the plan for how change is going to happen, right? This is where you're going to choose what type of intervention you're going to provide. This is where you're going to look at that assessment data that you had when you did your assessment and determine how are we going to best address the need that we see in our community? How are we going to solve this problem? And you're going to put together a plan of how to do that. So what you'll see in the larger behavioral health community is that organizations will have a strategic plan. Organizations that you work with will have a strategic plan, right? That's kind of that roadmap of the steps that you're going to take to fulfill your mission, to fulfill the work that you all set out to do, and to really be able to help get to the outcomes that you wanted to see. So there is going to be a strategic plan. This is a huge opportunity for engagement because the strategic plan isn't just it isn't set by one person that comes and just puts this all together. This is a community process of coming to how you're going to get to a plan for your community. So how many of you have seen your community, your strategic plan in your organization, and could share a little bit about what that looks like, what that is, how familiar you are with it? And don't worry, because I know I've been a social worker probably for 15 or 16 years. And I had no idea there was even a strategic plan until about 4 years ago. I was like, what is this? This is like this roadmap that everyone's using. to decide what programs are going to be there. It saved me a lot of frustration and time when I found out that there was a strategic plan, because the things that I was trying to help promote new programs and things through my organization, when I knew the strategic plan of my organization, I was able to say, oh, let me make sure this aligns with that strategic plan, right? And then you also want to know about your strategic plan, because that's where a lot of the funding goes. So when an organization has a plan, the funding that they come in is used to make that actualize that plan. So to make sure that that plan happens and occurs. So again, it's always nice to know about your strategic plan, but don't worry if you've never seen it. That might be one thing that you want to do, is like go to your website for your organization or any organization that you're interested in. And usually in that About Me section, it typically will let you know what their strategic plan is. So then you can see like what they want to accomplish and by when they want to accomplish it. So just kind of thinking about strategic plans, the process of that is really when an organization or a group, right? It doesn't have to be an organization, but that group looks at what are their strengths, what are their weaknesses, what are their opportunities, and what are their threats. So when you're talking about strengths and weaknesses, those are things that are going to be internal to that organization. So what are the strengths of the organization? What can they do well? What do they excel in? What are the bright spots in that organization? And then they're also going to look at what their weaknesses are, right? Where are some areas that they get for improvement? Maybe where things aren't running as smoothly as they want them to. But then when you look at opportunities and threats, those are going to be looking at external to the organization. So what are the opportunities that exist in the environment around the organization that can really help move that organization can really help address? And then also, what are some of the threats? So I'll give you an example. So in behavioral health, some of the opportunities right now is there's increased funding for the recovery community to do a lot of work in communities to really help with recovery efforts, right? That's a huge opportunity in the recovery community. Maybe some of the threats might be the process that it takes to embed peers into traditional services, in my opinion, is not going fast enough, right? And so how do we, that might be a threat to the work that you want to do, right? So that might just be something to keep in the back of your mind, or something kind of that you might have to address in order to get what you want to get done accomplished. So those are, when we're thinking about a strategic plan, these are the things that we're thinking about. So as you all think about the behavioral health community, what other opportunities do you see out there? They might exist at your organization, in your community. What opportunities, or even what strengths do you see? We can start there too. What strengths do you see in yourselves and your organizations, and what opportunities do you see within the recovery community?
I'll go. So my organization has a wonderful working relationship with a well-known nonprofit here, First Call for Help. It's been really great. They've really helped our cause out a lot, and I think it's been just amazing, and it's definitely helped us out a lot. And then moving forward, a threat, I guess you could say, or an obstacle would be like the whole grant writing process. I'm not very educated in that department, so I did have to make a decision to step back from applying for the recent money because of being ready and different things like that. But everything is a learning process, and I don't know. I'm just great to be here. I've missed the last couple ones because it's been just crazy. So it's really nice to be here.
Yeah, thank you for sharing, Cynthia. I think you make a great point, right? That strength is that collaboration that you have with that other organization, right? And it's an opportunity to do more and expand, right? And then thank you for sharing about the threat, especially around grant writing, right? That's a threat for a lot of us, right? Of just that whole process and how is money allocated, and you have to have a background in it before, when you're writing those grants, so that you can get the money that you need to start the work that you want to do. And so that definitely is a huge threat for a lot of people around how do you get that like for the behavior, for the recovery community, right? The money's there, right? There's the opportunity, but how do you access it? So that then becomes kind of a challenge or a barrier. Yeah, so thank you for sharing. Other thoughts on strengths? It could be individual strengths, it could be organizational strengths, opportunities that you see in the recovery community, threats, weaknesses.
One thing I saw when I was running an RCO was that we were always hustling for our dollars, and we didn't even really get to the point of strategic planning. And if we did it, it was kind of done by the board in a separate space. It might be shared with us, but it just sat on a shelf and kind of collected dust because we would get so busy putting out fires. It just felt like we could never get ahead to the point where we could really even look forward and down the road, because we were so rooted in like, keep the doors open this month. And then next month would be the same thing. And so I definitely would see that as a weakness and really an opportunity kind of like, how can we think differently about the work we do? Yeah, but then the threats too, I know those are external. So maybe it's a weakness is thinking we had to do everything and really not seeing partnerships as valuable as they can be. So rather than starting a new program, looking around our community and saying, who does this super well because it's not our wheelhouse, and how can we partner with them to like write a grant together? But often we didn't really think of that until like the RFP was out. And so I think it's about that like continuous process of building those partnerships and relationships. So when funding does come out, you feel like it's a natural kind of marriage.
Absolutely. Yeah. Thank you, Chris. You brought up a lot of points, right? I love the idea of like when you're looking at the recovery community and the strengths in it, looking at the full community, right? Who else in the community could support or could I collaborate with to really help move things forward or help mitigate some of my weaknesses, right? Or my challenges. Jessica, you want to jump in? Go ahead.
Yeah. So I know, we have I feel like we have a lot of uniqueness at the place that we work with. And a lot of people who come through there, we kind of try and match them up because we want people to be able to have that connection, with who they're working with. And that's very important. But part of the issue is that we'd like to be able to, we have such a small staff. We're very small staffed. It's at Perfectly Flawed in LaSalle. And so we have such a small staff, and we'd like to be able to expand that. But yeah, funding is part of that, right? Because how many people are really going to come in, use their time, like me right now, I'm coming through, I'm getting my education, I'm doing what I need to do, going through these classes and getting certifications and stuff. I'm not getting paid right now. I'm okay with that because I have a passion for that, so it's about finding those right people. And when you're in smaller areas, sometimes it's really hard to find. And so on one hand, it's like, we don't want to look because we feel like those people will fall in place when it comes time for them people, to come in and to be there and be a part of it. But at the same time, we know we need staff, right? So we're like, and it's definitely quality over quantity because it, takes certain types of people to work with other people. Not everybody can work with other people, So we've learned a lot, like together and separately, all of us, we come together and we sit, we go over it. And I feel like due to lack of funding or due to funding, lack of funding on our part, because as it was already said, it can be really hard going for those grants, and you know what I mean? And the grants are supposed to be temporary till self-sustaining kicks in and things like that. So it makes it hard because you try and keep this place running, and we're doing it. It's running, it is running, but without that manpower there, and that right kind of manpower there to back that up, that's it. It makes it really, really hard for us to, get through some of the things we have to get through and see everybody that does need to be seen. And, trying to keep it to where, when people come through that door, we're not like, hey, what's your insurance? How much money you got? Because we're trying to make it not, go that way. So, I mean, I think there's a lot of opportunities though, all the way around in the whole thing. I know, we're at the start of something big, things are starting to move a little bit different now. So now that all these programs are being implemented where people can go and get their credentials for their CRSS and different things like that, it's helpful because then they're coming in, on a paid internship, and that is, and they got the knowledge and they got, they got what they need. So I do feel like that's going to be very helpful. And I know that, that we've been working with a couple places that have people, coming out of school and stuff like that to kind of help us out and to come in on those internships to buy us time until we get to what the other side of that's going to look like. So.
Yeah, thank you, Jessica, for sharing that. I think you're absolutely right. You've mentioned a number of strengths and opportunities, right? So that opportunity of new people coming to the field, people able to being certified, which means they're getting the skills that you all need to really run things. But then you all, and I think Chris mentioned it as well, that strength is people first, right? You all are focused on how do we serve people? When people are at your door, you're not going to turn them away to go do something else. You're there to serve people. And so you're there saying, hey, come on in with that welcoming arms. And so that's a huge strength that you all have. And then also the ability to network, right? So as you said, Jessica, other people coming in, being able to find out who does what, and then just more people coming into this field and into this space that want to help and that also have this, are getting their education and getting the skill set to help, right? And I use that term education loosely, right? Because that looks a lot of different ways. It doesn't necessarily mean like a university education. It means just education and knowledge, right? That you can apply. And so I think those are other opportunities in the recovery community as well. So as you're thinking about strategic planning, this is one of those tools to use, right? It's called a SWOT analysis, right? So you see the SWOT, the SWOT analysis. It's really taking the time to look through all of those things. And this would be something that you all could go back and try with your organization, or even just kind of write it down on your own. What do you think are the strengths, the weaknesses, opportunities, and threats? Because once you have those, how this helps with building a strategic plan is that you then start to see what your strengths are and how you can use your strengths to maximize your opportunities, right? So if one of your strengths is really your people first centered and you have a great ability to make relationships with others in the community, then you might be able to partner with someone who can help fulfill, who could help maybe where you guys aren't as strong, they could help fill some of those needs, and where they're not as strong, you could help fill some of those needs. So that's the kind of things you want to think about when you're doing your strategic plan, is how to use your strengths to take advantage of those opportunities, and then also to kind of prevent those threats from occurring, and then also being able to pull in other people to support, especially in areas where there's challenges or barriers or weaknesses. So Cynthia.
So one of the opportunities, it was a weakness that I came across actually. So now that you're guys are helping jog my brain here, one of the weaknesses or threats that we had, is that a lot of people really don't have time to volunteer. So my Mission Restart, the organization that I founded, it's all ran on volunteers right now. We don't have an income. Everything is volunteer ran, and getting people to volunteer is a lot harder than I thought it would be. So what I did is I had a connection through First Call. She actually works at First Call and through probation. So me and her met up, and she's the probation person that is supposed to find what is that called? Community service, and help people with that. So I linked with her. So now I've been able to get referrals from probation if they're so far along, and then they can help. And I've actually gotten a couple of different volunteers that way. So then, so if you find out where those people in recovery are struggling with those kind of things, I feel like it has given them more of a reason to want to give back too. if that makes sense.
Yeah, absolutely. Yeah, I think that's a great example, right? So what you identified was, one of your strengths is, having this organization and it's volunteer run, right? But that might be a challenge or one of the weaknesses because recruiting volunteers right now, right? People are having a hard time recruiting employees, let alone volunteers, right? And so really that being one of the weaknesses, but so when you're thinking about a strategic plan, you might have thought like in the next 6 months, I want to recruit, 10 volunteers. And how am I going to do it? And so that would be part of your plan, right? And then you would then look at what strengths you have, right? Your strengths of being a people person, communicating, being able to network. How could you use those strengths to really help you reach that goal that you had? And then you would have a time frame around how long it would take to do it. So essentially, when you look at those strategic plans, it's really listing, this is what we're going to do, and by this time. And so when you're doing that, you want to look at what is it, the work that you need to do. And then maybe it's taking advantage of an opportunity. Maybe it's overcoming a challenge or a weakness. Or maybe it's, really utilizing your strengths to move your organization forward. And then you have to look and say, okay, how can we use our strengths to do that? Right? What strengths do we have that we can be able to do that? And so when you're doing strategic planning, that's exactly it, right? A lot of times people look at strategic planning as this big mysterious thing, but really is looking at what strengths, opportunities, weaknesses, and threats do you have, and how do you use your strengths to move your mission forward, to move your organization forward, and take advantage of those opportunities that you see in the community, as well as overcoming those challenges, like those weaknesses or those threats. And then the other thing you want to think about is when you do identify what goals you want to take, is now you have to begin to prioritize them on two different areas. How important are they? And how likely is it to change, right? So we want to think about how important it is, because if it's not important, we probably shouldn't be doing it, right? Especially when we think about the time that we have. Our time is valuable. So if it's not important, it may not be something that we really want to devote our time to. The other thing you want to think about is how changeable is it. I think I made that word up, changeability. I don't even know if it's a word, but how changeable is the thing that you're trying to do? How much energy, effort is it going to take to make the change that you want to see? And so this is important because if it takes a lot of effort, you want to know that up front, right? Because you don't want to put a goal that's going to take, a year or two to reach just because of the number of things that need to change or happen before things can change. You don't want to put that as something you're going to change in the next 3 months, because you're going to be frustrated, right? Because it's not going to be able to be achieved for 1 to 2 years, just because there's other things that have to happen. Maybe there's a sequence of events that need to happen before that can change. So you want to know how long is it going to take, because you want to know how much energy or effort is going to be required for it. And then you also want to know how important it is, right? Because again, if it's not important, then that's probably something we shouldn't do. Where you want to be is you want to look at something that has high importance and is easily changed, right? Because that's where you can make a lot of wins very quickly, right? On something that's important. And sometimes, even if it isn't as high of an importance, but you can change it very quickly, these are those small wins that just get everybody going, right? And get everybody rallied around something and things are moving. So that's kind of what you want to think about is when you think about what you want to do, where does it fall on this matrix? Is it high importance and easily changed? Is it low importance and easily changed? This is where you don't want to be, right? Where it's low importance and it's very hard to change. Because if it's not important, we don't want to spend years working on something that isn't going to change. And it's not very important to us, right? Or to our efforts or to what we're trying to achieve. So those are things to think about when you're strategic planning. You'll have the slides for this if you want to just kind of, as you have ideas and you're moving forward, just kind of compare how changeable is it and how important is it. And it really help you with kind of prioritizing and decision making on what you want to move forward with and how you want to move forward with it. And then the other thing I wanted to highlight around strategic planning is types of approaches, right? So types of interventions. What's the number one intervention that we always hear, right? When we want to change something in a community, what do we always want to create? I can see your mouth moving, Cynthia. Did you say a program? Well, I'm going to go with that. It's a program, right? We always want to create a program, but the interventions always don't have to be a program. There are a number of other interventions. So, for example, you might look at maybe a policy needs to change. Maybe you want to have your efforts around changing policy. Or maybe you do want to create a program, right? But this, also think about a program. It's going to take a lot more time to get the structure and the activities, the structure in place to then be able to put that program forward. Maybe you just want to do a project. Maybe this is just a quick, small scale project that, you know, if you implement, it'll create a lot of change. Or maybe it's personnel changes, right? Maybe the right people aren't in the right spaces, so you have to move people around, right? And then you would be able to achieve the thing that you want to achieve. Or maybe it's just changes in practice, right? So organizations are great for doing things the way they've always done them, just because that's the way they've always done them. And so when you think about what needs to change, it might just be a change of practice. It might just be an innovative way that an agency is solving a problem with the same resources, the same people, but they're just tweaking how they go about doing their work. So again, I wanted to leave the strategic planning section with, what are other ways outside of a program to really be able to affect change? Have any of you had experience with any of these other types of approaches, like interventions to change, like changing a policy or a project or practice?
Yeah, so I started off in a clinical setting, and a lot of the trainings that I was attending and hearing, you know, there was just certain things you do and you don't, you know, for certified peer support specialists, peer recovery specialists. And it really didn't sit with me correctly. Like I really struggled with it. And during COVID, it hit me. And that's when I started getting people together and formed Mission Restarts board and then started just slowly moving forward with that process. And lo and behold, a little over a year later, I am where I'm at now. So it's kind of interesting. And I know that that's kind of creating a program, but it was also a project, I feel like, too, because it's still a work in progress. There's still lots of work to get done. And, you know, I only meet with people as they come in and as they reach out and as I'm able to reach out to them. So it'll get going more. So I think I need to look into some more of the personal changes because I have 6 board members right now, and I'm the only one doing any work. So I do know that I'm aware of things like that. So yeah, I really like that you have it put out, and I took the notes so I can actually have something to look back on. I just think that I would have never looked at it in this aspect, I guess, is what I'm saying. So
yeah, thank you. Yeah, I think you talked about a change in practice, right? Because how things were currently be done, when you were sitting through that training, you're like, oh, maybe we could do it differently, right? And that was just kind of maybe the way that we've always done things, and the way, especially in behavioral health, having worked in behavioral health for a number of years, we typically do things the way we've always done things, right? And getting into innovation is where we need to really head towards. So yeah, you're also talking about a program, but also a change in practice as well. So thank you. Yes, Jessica.
I feel like right now, as I said earlier, you know, I think the whole face of recovery as a whole is just completely changing. But also, you know, when I had first come in, when I first started, hold on, Isaiah. Sorry, my 9-year-old, please. Baby, I'm on a class. Hold on, please. So when I first started, the plan was I was coming in, I was going to do, you know, training for recovery coach and going to get my CRSS. Now, for me, this worked out because my man goes to work, right? So I don't have to work a full-time job and pay bills. So I was able to give that time. Now, when I first come in, something that I thought about was, in my own experience, when I had earlier on in my recovery, one of the things that I thought back on that I remembered very, very hardcore was my anger. I was extremely angry. Like that first 3 months was just insane. And so because of that, I thought, you know, I feel like we need to do something to be able to implement something to where we can help people with anger, because in our area, we don't have anything right here. So we have to send them out of town. You know what I mean? And so we had kind of talked about that, went over all that. And so, now there was two of us, me being one of them, the other one, we went and we got certified for our anger management. That's something that, originally that was not in the plan. That did not have, anything to do with anything that we had going on. But after speaking as a team on it, we had all come to, a conclusion and an agreement that, that does play a really big part and people getting through hard times or people getting past, certain things. And it is learning how to control their anger, and most of your emotions, they end up as anger. They don't, it doesn't start that way. So for people to be able to kind of veer around that and know, what that looks like and how to handle it when those pressures come, we felt was very important. And so that's something that we kind of changed in the program that's already set up down there, that not necessarily changed. I guess it was additional added to. And so we had done that. So that is one thing that we did change. And we did also notice that as we offered counseling, and we had an actual counselor down there, not a counselor. She wasn't a counselor. She was a another word for it. It's like right under a counselor, but that's pretty much what she did. She helped people unpack things, and it was getting very clinical in that space, and it was coming off that. So that was something else that was realized. Well, we really wanted to stay away from the clinical. How they have like the living room spaces and things. Like, we wanted a real comfortable, we didn't want that clinical in there. So that was something else, we had to go over and, is this really what you want? As when you have somebody, and that somebody's not me, but when you have somebody who is the founder of a place and that executive director, and they had this vision, you do still want to stay close to what that vision was to begin with. And so, we had to pull some of the clinical out, and we had to implement other things because of it. So I do feel like it's definitely a learning process as you go. And the more people we work with, the more people like Luke, my boss, the more people he gets out there and he gets with, the more he learns. He learns so much, and he'll come back and he gets so excited when he comes in, from like a meeting or something. He's like, I met with all these great people. They had so many good ideas, and he'll lay it out all on the table, for the whole team. And we'll go over each one of these things and what we think and why, and things like that. So he does really well keeping us all in the loop, and like everybody, with the teamwork, he does super awesome with all of it, But so that's a couple things that we've kind of, noticed. Okay, maybe we should pull this down a little bit. Maybe we should put this one out there a little bit. So that's what we've done.
Yeah, thank you, Jessica. I think you mentioned personnel changes, right? So when you all went and got certified in anger management, or like anger, to be able to provide like services for addressing anger, a personnel change, right? So now you have individuals that are able to provide a different service at an organization. It didn't mean a whole new program. It just meant you changed the personnel just a little bit so that you can provide additional services. So that's a great example of, different approaches when you're thinking about what's your plan and what you want to do. Everything doesn't have to be a program. It could even just be kind of tweaking what you're already doing, a different type of project, a change in your practice, or a policy. Great example. Thank you.
Mitzi, I just wanted to add to that too, that I think that's a unique part of recovery community organizations, because the number one thing we're always looking for is people with lived experience. And so someone maybe newer in recovery, and they actually don't even know, like, what is it I'm good at? And so we might hire them into the role of, say, they come through a recovery coach training, and now they're going to be providing direct peer support services, but maybe their wheelhouse is somewhere else completely. And so as directors and program coordinators, we're always looking at what our staff is interested in, and where can we shift them and grow them in another area and kind of grow their recovery capital, expand their resume, which makes it even, it's a huge part of an RCO, but also it can make it really challenging, because sometimes what's on the position description, they may qualify for, but again, it may not be the thing that makes them light up. And so I think those personnel changes, even changes in practice too, are two areas that are really key to running a recovery community organization and being, I think you have to be intentional and explicit in doing that work. So people don't just feel a sense of burnout too, like, oh, another day in volunteer coordination. I really want to be doing data management. Like, that's my thing. Like, I want to sit back there and play with the numbers, but I'm in this role where I have to be extrovert, and that exhausts me.
Yeah, I think that's a great example, and like of how it probably shows up, right? In RCOs, maybe, part of that strategic planning is how do we make sure the personnel are in the right places, people are in the right places to do what they love, so that they are coming to work or volunteer every day, excited about the work that they're doing, to prevent that burnout, which is real, right? And the thing that you mentioned, Chris, too, that I like is that when you think about this a lot, I'm going to go back for 1 second. When you think about this kind of process, one of the things that you all could do is for yourselves, right? Think about yourselves. What are your strengths? What are your own personal weaknesses? What are opportunities that you see out there for you? And then what are some of the threats, right? And then that way, when you're thinking about where do you want to work, where do you want to volunteer, what do you want to do, kind of what your opportunities are, what your strengths are that you bring to the table. So it helps you align yourself as well with the organization that you want to be with, or you're creating your own. Jump through this real quick. So the other thing to think about in strategic planning is just kind of cultural responsiveness, right? So every group has subgroups. So how do we make sure that we're also engaging those subgroups within a community as well? So tips to do that are just making sure that we're including diverse individuals in the strategic planning process, right? I heard, I think Chris, you had mentioned that a lot of times organizations will plan and they don't have people with lived experience at the table. How is that possible, right? If you can't plan services and then place them in a community and say, here you go, it's the community that should be planning the services, saying, this is what we need, almost like what you did, Jessica, saying, hey, this is an area where there's a gap, and what we can kind of fill that gap in related to the anger that individuals feel. And so when we're doing the strategic planning process, we want to make sure that we are including individuals at the table, especially the individuals that are going to be benefiting or that are going to be impacted by the intervention that we decide to implement, right? We don't want to just take an intervention and say, here you go, this is what we decided for you, because no one wants that in any part of their life. So when we're thinking about like larger organizations as well as our own organizations or your RCOs, just thinking kind of like, what are those, how do we also make sure that there's diversity and inclusion in there as well? Also thinking about, is the intervention, is it a cultural fit, right? So that means, does it fit the culture, right? Does it fit the recovery community culture, right? So this intervention, is it going to be something that's going to be useful in the community, or is it not going to be useful in the community? And then also, when RCOs are planning, how does that fit with individuals from diverse backgrounds? Does it also fit their individual diverse communities as well? And then the same thing with how effective are the interventions with diverse groups? So a lot of times you'll hear a lot about evidence-based practices or best practices that have been researched, but you want to know the individuals that have participated in this research, do they represent the community that's going to be receiving this intervention? So if we have an intervention that has been researched in Australia, is that going to fit what recovery looks like in America, right? So we want to make sure that we know, does this fit with the diverse groups that are going to be receiving this intervention? And then you also want to make sure that when you decide on an intervention, you tailor it to that local community, right? If you need to tweak things, if you need to change things so that it fits better with the members that are going to be engaging with it, if they want to tweak it, then having that space to allow them to tweak it a little to see what works for them. And then also taking that feedback on those interventions from the community to say, hey, is this, we've decided this together, and then is this really working as we intended it to work? So those are also things you want to think about in strategic planning, as well as allowing the community to set what outcomes are we looking for, right? What do we think we need? What's important to the recovery community? What's important to the community, our local communities? Are those the outcomes that we were looking for? So I'm going to switch gears now and talk about implementation. So implementation is the idea of let's get started, right? And everyone comes to implementation and a lot of times they're like, oh, we know what to do, right? We're just going to get it done, right? But one of the things that we don't think about is there has to be a plan for implementation, right? Because I don't know about you, but I've worked with a lot of organizations or been a part of a lot of organizations where there's a program, everything is set, we have a plan, and then we go to implement that strategic plan. When it comes to implementing, we didn't do the groundwork, and then we end up with no one at our door, right? That's receiving the services, right? No one's really engaging with us. And so we didn't think about sometimes that implementation plan and what that's going to look like. So there's a number of things to think about when you're going to go implement a program or a project or policy change. Is really looking at, so first one is the site assessment. That really means the organization or the group that's going to be implementing this program, project, policy change, whatever it is. Do they have the right things in place to really be effective at implementing this intervention? So for example, do they have effective organizational practices, right? So if you need structure in your organization, do you have that? That might be staffing, right? It might be qualified staffing, right? Do you have people that have the right certifications to provide the service that you want to provide? Do you have enough staffing to provide the service that you want to provide? Do you have, if you needed a facility, do you have that facility, right? And then do you have the right type of, if you needed like a license from the city for something to run a certain type of organization in certain buildings, do you have you have those permits, right? So you want to make sure that when you're going to implement, you want to make sure that you have that the organization that's implementing it has all the tools and the right things in place to be able to implement it, or it's going to be a huge barrier. And sometimes it'll make things screech to a halt, right? The things that you want to change can just be stopped because we didn't have the things in place that we need to have in place, right? Qualified staff, I think you guys are all familiar with, right? The right certifications, the right including like people with lived experience, right? That to me is qualified staff, right? If we don't have people with lived experience in the recovery efforts, then what are we doing, right? Program champions. Program champions could also be project champions or policy change champions. These are people that are really going to open doors for you, people that are going to promote your program, people that are going to help you wherever they can. So if you need a grant writer, then this person can be like, hey, I can try to help figure out who can we find that can do grant writing. If you needed some support with recruiting volunteers, then this champion would be like, hey, let me go and get the word out on social media for you to recruit volunteers. So you really want someone that's going to help champion it. It's almost like they're leading the way before you, right? It's like they're blowing a horn before you, letting everybody know that you're coming so that people know that you're coming and can jump on board, right? You also want to make sure if you need training and technical assistance that you have it. And the Center of Excellence is huge for that, right? A huge resource for you when you're thinking about implementation to have that training and technical assistance that you need to really make sure that you have the things in place that you need so that when you open your doors for your program or when you go to implement your policy, change, or you're knocking on the legislators' doors or whoever or whatever that looks like, that intervention looks like, that you have the right things in place to be able to accomplish and achieve what you set out to achieve. And then program integration is kind of thinking back to that strategic plan. Is the program that you're doing or that you're wanting to implement, is that integrated with the organization that's providing it, right? So if the strategic plan says you're going to set up a number of programs, but this new program that you want to set up doesn't fall within those programs, then you don't have program integration, right? It's not something that the organization, the direction the organization is headed in. You want to make sure what you're doing aligns with that. So Jessica, I think you had a great example when you said you added that certification in anger management, that was a direction that the organization was already headed, right? But if you would have thought about clinical, then you said, no, the organization isn't headed this way, so we're not going to do that. So instead of setting up a clinical program, you focused on what it was the organization wanted to do. So that's kind of integrating into a new program, project, intervention into what the organization is already doing that fits with what their mission is, what their vision is, and where they're heading, versus trying to take something that's completely outside of that scope and then put it in there, right? Because you can still, if there is a need for clinical, that's great. It could still be satisfied, but maybe it's not this organization that does it. Maybe it's another organization that does it, that program would be better situated with. So those are some things to think about with implementation. And then implementation fidelity is just when you have an evidence-based program or a best practice, like if you have a program that tells you, do this step, this step, this step, and this step, how much are you really following those steps to get the results that you want to see? So that's also what you have to think about with implementation, is when you start doing the steps, are you staying in line with the steps that curriculum or that program said to do in order to be successful? Now you can tweak it a little bit, or again, to match that local community. But if you start to tweak it too far, then you're going too far outside of what was researched to show that this works, right? So you want to make sure that when you're thinking about implementation, that you're also thinking about how can you do the steps for those, whatever program that you chose that you did, right? And if you're creating your own program, then this wouldn't apply. If you're creating your own steps or your own interventions, then there is no fidelity to it. You probably would want to think about how you evaluate it, which I think brings me to my next point, right? How do we know what we're doing is working, right? So this is the other thing about change, right? A lot of times we do get in there, we do the work, we're working with people, but we don't take the time we don't take the time to really evaluate what's going well. Is it working? And are we helping people like we wanted to help people, right? So this is where knowing evaluation comes in, not evaluation, knowing to evaluate comes in handy, right? And again, this might be one of the things that you work with someone to do, or you partner with someone to do, or reaching out to some of your contacts at the Center of Excellence to say, hey, we're doing this. Is there evaluation that someone could help us with evaluation of things? And then when you think about your goals, part of evaluation is just having goals, right? And some of the evaluation doesn't have to be this big, long, drawn out process that looks like research. Sometimes it's just having a goal and then monitoring that goal to see if it's working, right? So when you create your goals, you want them to be SMART, right? So SMART stands for specific, right? You want to be specific in what you're doing. You want it to be measurable, right? So you want to be able to measure what you're doing. You want it to be something that's achievable, right? You don't want to have this goal that is so far out there, you'll never be able to achieve. You also want it to be relevant, and you also want to have a time bound, so time attached to it. So when you think about a goal, you might say something like, by December of 2022, we want to implement this new, we want to have 5 new people certified in anger management at our organization, right? It's specific, you know what you're doing, right? People are going to be certified in anger management. It's measurable because if you don't have 5, then you didn't reach your goal, right? So it's measurable. It is achievable, right? And then it's relevant to what your organization is doing, and then it's time bound, right? So by December of 2022. So those are the things that you want to think about when you're thinking about creating goals. And then that way you're just monitoring those goals to see if you reached it. And one way, without having to have this big, long, drawn out evaluation, is if I set up a goal, then I want to make sure that I have indicators, right? Those are the things that are going to tell me, did I reach my goal or not, right? So for example, if my goal is around reducing substance use in a community, then I might look at the number of people that are participating in treatment. That might tell me, are people actually being involved in treatment and substances there's going to be a reduction in substance use, right? We might look at the number of overdoses, right? So if you see the number of overdoses going down, then you might be able to conclude that there's a reduction in substance use, right? If you see drug court graduations going up, then you also might be able to conclude that there's a reduction in substance use, right? So evaluation doesn't have to be this long drawn out evaluation plan by an expert that comes in. It's some of the things that you can do when you have a goal. You just have to decide how are you going to measure that goal, right? And you're going to look for things to be able to measure it. So if you're looking, let's say in the recovery community, you want to make sure people are employed, right? And that's one of the goals that you have is increased employment. Then you might look at the length of employment for people in your program, right? And that might be a way to say, is this program working, right? People are having higher levels or are retaining employment longer, right? You also might look at something like the number of interviews people have, right? If you see an increase in the number of interviews that people are having, then it's really going to help at least allude to the fact that there is increased employment, right? That at some point people are going to start getting employed as those numbers go up. And then also the number of job offers might be another thing as well. And then again, for the final one, if you're looking at a goal of increased healthy relationships, you might measure that by saying, how many positive relationships do people in our program have, right? What was the number before and what is it now? You might look at marital satisfaction or marital relationships. Are we seeing increased marital satisfaction for those healthy social relationships among our participants, or the parent-child relationship, right? Are people reporting that they have a better relationship with their children as a result of participating in our program? So as you think about evaluation, again, it doesn't have to be an expert. You can if you want, and I'm sure the Center of Excellence could help you in that, like point you to some people in that direction. But you can do this yourselves too, right? You just have to find once you have your SMART goal, then you have kind of how are you going to measure it. Think about how you're going to measure it and what do you have access to, right? So if I didn't have access to the number of people participating in treatment, then I'm going to choose maybe drug court graduations, right? Something that I do have access to be able to check. Any comments, questions, thoughts about evaluation, monitoring?
I think that can bubble over into a lot of things, honestly. I really do. Even if you look at even if it's something as simple, not simple, but it's something like a domestic violence program or anything like that. It's just like you're saying, if you don't have the information, you can't measure anything, right? So you gotta have the information for it. But I think evaluations are extremely important because then you can see we're either, okay, this thing's working, so we can keep going with this thing because it seems to be working fine. But if something's not working, then the manpower, the time, the energy, and everything going into it, you could troubleshoot, find out why isn't it working. What, it might not be for you. It might not be for your place. It might not be for your area, or maybe it just needs tweak. Maybe there's things that need to change within that space. So I think evaluations are extremely important in this line of work for anybody. Because if you don't know, if you don't know how much help someone's getting, you really don't know the impact that you're making. And you want to be able to measure it, because otherwise, why are you doing what you're doing? We're doing this to help people, and it's helping people transition from negative lifestyles into positive ones. No matter what that looks like or what implementations need to be taken to make that happen. It needs to be measured, or we don't know if it's working.
Yeah,
so
well said. Very well said, right? I couldn't have said it better. You're exactly right, right? If we're trying to engage people in change, then we need to know whether or not change is happening, right? And that's where evaluation comes in. Yeah.
When I would just say too, to think about this when you start, like when you're starting to develop a program, like think about those outcomes. Like, what do you want to see changed? What is that vision? Because of this intervention, here's how things will be different. And start to think about those outputs, like those specific measures that Mitzi was mentioning that you're going to, keep track of throughout the program. Because oftentimes I think we're working in busy environments, we're small staffs, we're overburdened. and evaluation becomes an afterthought. But it is just a change in processes that once you introduce it, it kind of becomes the norm for your organization, that we're beginning with the end in mind. And it's not as a heavy lift if you can just build it in while you're developing the program, than if you're halfway through or even towards the end saying, oh gosh, I guess we should have really thought about how are we going to evaluate the effectiveness of this program. And I love and really appreciate that you're bringing up, Mitzi, how it doesn't have to be like a funded research study by a university or something like that. We have access to Google Forms and different surveys. In different ways we can pull that information out. And then when I've spoken with policymakers, it's our stories that really impact them. So combine the numbers and then get qualitative information, get quotes from the people you're serving about the impact of the service. And you can display those everywhere. You can use those on social media. You can use them on your website. You can use them in applying for grants. That those qualitative statements by the people that were impacted by whatever program they were in are just gold.
Yeah, absolutely. Yeah, I agree with you 100%. I feel like it really is the stories that people want to hear, especially when it's, for change, and for like policy change, they want to hear your stories. And then you have that, if you marry that with the data, right, that then supports that and shows there's been a change based on your program, then it really increases your efforts and increases your likelihood of being getting funding opportunities, getting additional support for your program and things like that. So yeah, I agree with you. Carolina.
Hi, good morning. I apologize for coming in late. I was in another meeting. But I'm with a recovery community organization in Southern California, the Happier Life Project. And as I'm hearing this and going through this, like, we're working right now for a peer run respite, right, in our area that is like, I think there's like 2 or 3 maybe in the whole state of California. And I'm doing a lot of the like pulling data from, case studies and other respites that have been followed throughout the United States, and I guess to begin this, right, because I'm trying to get it funded, is like, it's okay to use, even though it's not like specific to our area. I mean, it's still impactful, right? Like, to be able to use that until we can have our own information and things like that to then present to continue to get it funded, right? Because I feel that ultimately all the organizations that are in our area that are already doing amazing work have this same gap that they've all like mentioned, right, in conversations and stuff. And I'm like, how do I contextualize that and put it without saying, hey, I need a quote from you, or I need something from you to prove it, even though we're all saying the same thing. Right? So I don't know how to bring that together, I guess, and not just kind of impose like data from like all these other places. So I don't know if you have any suggestions for that, maybe.
So then, how do you get those stories from people, and how do you get it from like that local point of view?
Yes, yeah. Because we don't have it. So nobody has that experience to share on it, right? It's just how we know that it works in other places, or that the alternative is actually kind of harmful, if that makes sense, without wanting to like kind of put dirt on what's already in existence.
Yeah.
I don't know. That's where I struggle a little bit.
Yeah, I think part of it is looking at kind of what, if you're not already implementing the program or the intervention in your community, and so you don't have the data to show kind of locally that it works, you can look at what's happening in other areas as an example of what's going on. But then you could also think about maybe, looking at, I don't say research, but I mean, you could look at research, but you could look at other communities maybe that are implementing that program and get quotes from them about how it's changed their lives and what's going on there. And then, or you could do kind of a small pilot and just say, hey, here's a number of people, like we started with maybe 5 people and they had a taste of this program, but from that little bit of that program, this is what they're saying, right? So you might even be able to start it just on a small scale and then think about how can you get that information locally to really be able to share on as well. Or you could think about surveys that would ask people to kind of comment on if there was a program like this, what impact do you think it would have on you, and how would you engage on it? Those type of things.
Okay.
Yeah.
Thank you.
Yeah, no problem. Thanks for the question, Jessica.
Mine was actually for Carolina too. I know,
Okay.
like here, and if this isn't okay, just let me know, because I'm new in this too. But
Oh, no,
I
you're
know
fine.
things that we have done when it comes to that is like, okay, so if you're looking, if you want to see how many overdoses, right, was in your area within a certain amount of time, we went through the coroner's office. Okay. And then like the health department has a lot of really good information that it's not always just, put out there. But if you were to call your local health department and speak with them on some of the things, or maybe the information you're looking for, they might be able to be like, hey, we have this folder of this information that you might, you know what I mean? So like even like places that are already set up, like governmental places or the coroner's office, places like that might be able to help. And when it comes to programs and like even Mitzi was saying, like pilot programs are awesome. They're great. They're just starting out. So it's not like you have this vast information, but you can still piggyback, whether it's somewhere that's like not too far off. Say you're on one side of California and you hear that on the other side of California, or maybe just over that California state line, somebody else is implementing something. So even if it's not in the same place or even in the same state, if it's still close enough to it, between going, through your county and your city and even state, I mean, there is a lot of information there. Even if programs, if I want to implement a program and a program that's just identical to mine has never been implemented before, my goal may still look the same as another program's goal that, they come out with a program and it wasn't for the same thing. It didn't get ran the same way, but the goal in the end was the same. So then you still have whatever data they have from their program, even if it was ran differently, to show like this program started here, they implemented 3 of these major things we would like to implement in our program, and these are the results they had. But I even think across state lines, it is still significant. It's not as significant as if you were to find somewhere, in your county, but I still think it's significant nonetheless. It just depends on what you're looking for and where you got to go for the information. So
Thank you. I appreciate that. Thank you, Mitzi.
Yeah, I think that was a great suggestion, Jessica. Very true. Your local health department, your local, if you have like a county mental health board, if you have, even thinking about like the police department typically has records of things. Just thinking about those agencies and organizations in your community that would have those records, or kind of could weigh in on some of these things around like, employment, or maybe your local court system would have some of that data too. So just thinking about those things as well. Yeah. Skip through that one. The other thing I want to think about for culturally for evaluation is also, again, thinking about how do we make sure that we're inclusive, that we have diversity and inclusion in our evaluations, right? So again, we want to think about when we're doing evaluations, we want to make sure that the evaluators, the people that are doing the evaluation, that they are representative of the community that we're serving as well, right? We don't just want outsiders to always come in and do the evaluation. We want people to be able to weigh in. We want them to have a chance, the community to have a chance to review the findings and make sure that the interpretation of those findings is actually accurate, and not just someone from the outside of a community coming in to look and say, well, this is how we're going to interpret this behavior, right? So for example, if you think about, different communities or your own culture or your own community, there might be certain ways that or certain things that you do that's, that's familiar to your community, but someone from the outside wouldn't necessarily understand. And so, or wouldn't have the same context that you have in that community. And so when they're trying to interpret what they're seeing or what the results that they're getting, they might interpret it from their own lens, from their own community, and not from the lens of the community that's actually the ones that are engaging in the services. So you want to make sure that you give people the opportunity to review those findings and participate in those, right? And same thing when you're working with organizations that, especially that are looking at recovery, and they're, taking those evaluations, and they are like the larger behavioral health community is evaluating the results. People with lived experience should be involved in those evaluations, right? They should be involved in interpreting that information so it's not a misunderstanding from someone who's not a part of a community that then is making assumptions or conclusions of another community simply because they're not a part of that community and didn't have the understanding or the background. And then again, you want to make sure that if you need to translate any measurement tools, so those are the surveys. If you need to translate those surveys, they're translated so that everyone has access. And then also being sensitive to cultural groups, their experience with evaluation, right? So evaluation hasn't always gone well for different groups in this country. And so you want to make sure that when you're looking at evaluation, that you're respectful of the history that people have with evaluation, and also recognize that maybe people declining to participate in evaluations isn't necessarily a judgment on their character, but it may just be a history that a cultural group has had with evaluation, and being evaluated on or experimented on, those type of things, right? So any questions, comments, thoughts, anything anyone would like to share?
Well, I know I was a couple minutes late on the on the class, and I apologize for that. But even just since I've been on this class, there's been a lot of really good information shared, and I appreciate that. I appreciate all the information, and I appreciate that people can get together from different places and kind of help each other out. And because this in itself is a journey. It just really is. It's a whole journey, And just coming into it, I remember I was so excited, and I was thinking, oh, this is gonna be great. I'm gonna go and I'm gonna do what somebody did for me, and it's like it's easy or something, right? I've been through it, I've been there, it's cool. But then you get into it and you realize, it's not necessarily hard, but in a way it can be. It can be hard, it could be exhausting, and I think that it's great that there's such a humongous support system out there for all of us that I did not ever realize existed, between RCOs and different people who are coming up and who are pushing for positive and pushing for good. It's huge. And the more we all get together, and the stronger this whole thing is going to be, and the more it's going to work for people. I know there's a lot of people going, come on, Jessica, you're going to go help one person. What is that going to do? What is it? Well, that's a ripple effect right there, dominoes, right? Because you're hitting all their family, their children, their friends, people around them. I remember when I first got into recovery myself, and it was so hard because I thought I was cool, before recovery, I was just real cool. So how do you not, okay, you're telling me I can't do all these things, and now you don't want me to be cool, right? So it's meeting other people and realizing that cool is all about perception, right? So to me, how life used to be cool is no longer cool. This is what's cool, helping people, uplifting and bringing people up. And that's what's cool. So when what we're doing, what every one of you and what everybody's doing together is we're changing the face of cool, right? Like we're showing people this is what's cool. This is what's happening. This is what it's all about, because it all comes down to love at the end of the day. You help each other out. And I feel like, going through my journey in my recovery has been about ignorance, because I had so much ignorance and there were so many things that I didn't know. And it's obvious to people, but when you don't know it, you don't know it. So that knowledge being shared and being brought to people and letting them know you're not comfortable yet, that's okay, whenever you come in, I'm here. That's being unconditional. It's showing them that they are people too. And I don't have to know you personally. I care about you because you're a human being, you know, let's figure this out together. That's huge, having somebody to walk by your side and believe that they have the best for you in mind. So to me, this journey means a lot. Like, and I'm going to push through with everything I got, you know, and I'm going to let everybody know this is the new cool. What do you mean? Like, I'm going to let people know, you know, what it looks like. So I think for everybody in this pocket that we're in here, I mean, there's a lot of wonderful people. I have met so many good people since I started this thing, and the support is just out there. It's horrendous. There is a lot of support for anybody who needs it, you know. And when you talk about the compassion fatigue and things, that is real. That is so real. And, you know, I think the support helps. I think even the classes help, you know, and it reminds you of what we're doing, why we're doing, the importance behind it. You know, it helps to fuel that drive to keep things going. So that was a really long comment, but I just wanted to let you know that. So I appreciate being here today.
Yeah, thank you for sharing that. I think you summed it up, right? I couldn't have said it, you know, and you said it very well. So, and I think it's a great segue because I think, you know, with Chris and Nell, they, you know, are really here to help, you know, continue to build that support network and really here to help and support in any way that they can. So with that, I'm going to turn it back over to Chris.
Thanks, Mitzi. Do you want to, I'll get up so we do a very short 2 to 3 minute evaluation at the end of each session. The evaluations are a way SAMHSA determines if what we're doing is helpful. So if you, there's a QR code, so I'll post that on the screen and you can just use your cell phone, point your camera at it. You'll get a pop-up window on your phone, click that, take 2 to 3 minutes to complete the evaluation. In the meantime, Mitzi, do you want to tell us about the extension learning that everyone will receive in an email?
Yeah, so after each session or workshop, we have the opportunity for additional learning. So what you'll find is that there's opportunities for, you know, viewing TED Talk videos, short video clips, and then just kind of some reflection questions to think about as you view those that will really help you think about these topics a little bit more in a little bit more depth. So what you'll find this week or this month is just conversation or discussion around these topics around strategic planning, implementation, evaluation, and additional tools and resources that you can use. We always have that challenge out there that if you're taking steps, or if you know, sometimes people are, you know, hesitant to take that first step to get started. There's this challenge of how can you take, you know, that first advocacy step. And if you've already taken it, it's also the challenge of sharing your story so that other people can learn from that step that you've taken as well, that we could share those out with other people to help encourage them to take that first step and get started. And that step doesn't have to be a big step, right? I think this month, you're going to read something about the power of small steps, and there's going to be a video on that. But it's just, you know, additional encouragement, additional tools, additional resources for you all on your journey. That for you to engage with, that will help, you know, hone this or kind of help take this conversation to the next level. And then also have that you can always refer back to.
Great, thank you. So after we wrap up today's session, early next week, you will receive an email from me, and it'll outline again that extension learning opportunity. I'll include a link to the GIPRA, which is the evaluation that some of you are completing on your phones right now. And then we meet next on July 14th. It's hard to believe it's going to be July in a month. What? And Kobe will be presenting for that session. And I think that's about it. If you have any questions or need any additional assistance, feel free to reach out to the Peer Recovery Center of Excellence, and you can submit a request for technical assistance. other than that, I just hope everyone has a good day, and I really value the time that you invested with us today. Thank
Thank
you.
you all.
Thanks.